Hello everyone, welcome to the CPT Guidelines tutorial series. In this video series, the first topic we are going to see is Evaluation and Management Coding Guidelines. So please follow my channel and check out my other playlist as well. CPT Evaluation and Management Guidelines Part 5 Prolonged services. Prolonged services refer to evaluation and management services that require extended time beyond the typical or primary service duration. These are used in addition to the base EM code when providers spend significant extra time with or on behalf of the patient on the same date of the service or other than the same date of the service. So it may be face-to-face or non-face-to-face, must be relevant to the patient care time or directly attributable to the EM visit. But it do not include time for separately reportable services, example procedures. The core principles of prolonged services after 2023 revisions, add-on codes. Prolonged services are reported using add-on codes, meaning they are never billed alone. But one exception is there, I'll show you in the slides. They must always be reported in conjunction with the primary EM service code. Time-based selection of primary EM. Prolonged services can only be reported when the level of primary EM service, that is office visit, hospital inpatient or nursing facility, has been selected based on total time beyond the highest level. Prolonged services are applicable only when the total time spent by the physician or other qualified healthcare professional exceeds the maximum or typical time associated with the highest level of the primary EM service in that category. So there are three categories available. The first category is prolonged service without direct patient contact on the date other than the face-to-face evaluation and management service. This is the new category added after 2024. This prolonged service without direct patient contact may be only be reported when it occurs on a date other than the date of the evaluation and management service. Prolonged service of less than 30 minutes total duration on a given date is not reported separately. Prolonged service of less than 50 minutes beyond the first hour or less than 50 minutes beyond the final 30 minutes is not reported separate. I'll show you how to do that. So here you can see there are two codes available for the prolonged services other than the evaluation and management date. The first one is 99,358 prolonged evaluation and management service before and or after direct patient care first hour plus 99,359 each additional 30 minutes list separately in addition to code for the prolonged service. So if the prolonged service is less than 30 minutes, they are not reported separately. So if the prolonged service is more than 30 minutes, so you have to code the 99,358. So more than 30 minutes up to 1 hour is the same code. After 1 hour, you have to surpass the 15 minutes limit. Then only you can add the code. So up to 74 minutes. That is 1 hour and 14 minutes, you have to code only one code, that is 99,358. If the extra time is passes beyond this 104, that is 1 hour and 15 minutes, then you have to add the add-on code, that is 359 you have to add here. So then every 30 minutes you can keep multiplying the add-on code. Second category of prolonged services is prolonged clinical staff service with physician or other qualified healthcare professional supervision. Codes 99,415 and 416 are used when an evaluation and management is provided in the office or outpatient setting that involves prolonged clinical staff face-to-face time with the patient or family or caregiver. So here we have to highlight this is done by the clinical care staff with the supervision of the qualified healthcare professional. So the physician or other qualified healthcare professional is present to provide direct supervision of the clinical staff. Prolonged service of less than 50 minutes beyond the first hour or less than 50 minutes beyond the final 30 minutes is not reported separately. So I'll explain in detail here. Let's look at this scenario. So a new patient coming for the clinic, for the office or the outpatient, that is for the straightforward medical decision making. So for the straightforward medical decision making, the time when you code with the time is 15 minutes must be met and exceeded. When you take 203 office or outpatient setting, low level of medical decision making, that is 30 minutes must be met or exceeded. So if the straightforward decision making, that is the maximum time limit is 15 minutes to 29 minutes. If it is go to 30 minutes, it's categorized as this category. So up to 29 minutes, you have to code this 99,202. So up to 29 minutes, 99,202. Then first 30 minutes, you can't code any additional prolonged code. So after 30 minutes, that in 59 minutes, 103, you have to code the additional code 99,415. So that is additional time of 1 hour and 14 minutes. If additional time reaches 1 hour and 15 minutes, you have to add the add-on code, that is 99,416. So like that, you have to calculate the prolonged time. So when clearly understand when you do the practice questions. So the third category is prolonged service with or without direct patient contact on the date of an evaluation and management service. So here there are two codes available. One is 99,417. It is a prolonged outpatient service done by the qualified healthcare professional. 99,418 is prolonged inpatient done by the qualified healthcare professional. Here you have to code additional code for each 15 minutes total time. But in our other two categories, up to 30 minutes, you have to make slots. But this code, 15 minute slots, you have to multiply the additional code. So let's see an example. So here 99,205 is office or other outpatient visit. When using total time of the date of the encounter for code selection, 60 minutes must be met or exceeded. So if it is 60 minutes, that is 255. For services, 75 minutes or longer. So the same code description will say within bracket. For services 75 minutes or longer, use prolonged services code. So if the encounter is consuming time more than 75 minutes or more, you have to go for the additional code. So scenario in 99,205, that is the high level of medical decision making. There the time duration is less than 75 minutes, not reported separately. Only 99,205 is reported. More than 75 minutes, you have to add the code, add-on code, that is 99,205 and 99,417. So up to 14 minutes this. So every 15 minutes slot you have to multiply. So another 15 minutes you have multiplied by 2. Another 15 minutes you have multiplied by 3. Likewise, each additional 15 minutes you have to keep on adding the multiplication. So this is the outpatient visit. So this additional code 99,417 is for the outpatient visit, 418 for the inpatient visit. Same thing for the inpatient. So in summary, you can see it is very clearly displayed here. There are 6 codes available for the prolonged services. You can see all codes are used as the add-on codes. You can see the plus marks. All codes are used as the add-on codes except this 99,358. This code you can use alone. So when you take 415 and 16, it is done by the clinical staff only, but by the supervision of the qualified healthcare professional. Other 3 categories are done by the qualified healthcare professional, but this category only done by the clinical staff by the supervision of the qualified healthcare professional. The service done in the outpatient on the date of a EM service with direct patient contact. So with direct patient contact, clinical staff doing, these 2 codes are used. 417 is qualified healthcare professional in the outpatient setting with or without direct patient contact. 418 is qualified healthcare professional inpatient with or without direct patient contact. So 17 is outpatient, 18 is inpatient. When you take this code 99,358 and 59, done by qualified healthcare professional regardless of plus on date other than the face-to-face EM service. All other 3 categories are the same date, but this is on date other than the face-to-face EM service. So here without direct patient contact. So when you see the specific scenario of each course, 415 and 16 used by the clinical staff with direct patient contact, 417 with outpatient, 418 with inpatient, 358 and 59 the date other than the face-to-face service. This is the summary of the prolonged services. So let's do the questions, then you will understand clearly what these are means. Question number 21. This is the continuation of previous parts. A patient had a follow-up visit for diabetes management. The physician noted a substantial increase in the patient's HbA1c level since the previous visit. The encounter included a detailed history, a detailed examination, and high level of medical decision making. The physician spent a total of 65 minutes counseling the patient, reviewing past medical history, and documenting the note. What is your report for this encounter? So there are 4 answers available. Take your CPT code book and find the answer. So in this case, we have to highlight this is a follow-up outpatient visit and high level of medical decision making. The total time spent here is 65. So how to start searching for codes? So first you have to search outpatient follow-up visit, that is established patient code for the high level of medical decision making. Then you have to find the time limit of high level of medical decision making. After that, you have to go for the prolonged code. So let's go to the CPT book. Here, go to the table of contents of evaluation management. Here you have to go for the office or other outpatient services. So this patient came for the follow-up visit, so that is established patient. So you have to go for this code series 99,211 to 215. So when you go to that code series, you have to find the high level of medical decision making code. So 2011 is not required the presence of physician. 212 is straightforward medical decision making. 213 is low level of medical decision making. 214 is moderate level of medical decision making. 215 is high level of medical decision making. When using the total time of date of encounter, the for code selection is 40 minutes must be met or exceeded. So here the time must be 40 minutes must be met or exceeded. So what is the upper limit? So upper limit, this is said in the bracket for services 55 minutes or longer. Use prolonged services code for 99,417. So straight away you can go for the answer, but for the purpose of learning, I'll show you how to find the prolonged code as well. So 99,215, the time is more than 55 minutes, you have to go for the prolonged code. So in our case, it is 65 minutes. So you have to go to the prolonged services by the presence of physician on the same day. So for that, you can directly go to the 417 code, but for the learning purpose, I'll show you. With the footnote, you can straight away go for the prolonged code, but for the learning purpose, I'll show you how to find the prolonged code here. So we have established the primary code. Then we have to go for the prolonged services. So prolonged services, there are three categories. Prolonged service without patient on the date other than the face-to-face. So that is not suitable. Prolonged clinical staff service. This is not a staff service, this one. Prolonged service with or without direct patient contact on the date of evaluation and management service. So this is the correct code area. So let's go there. So there are two codes. 99,417 is for prolonged outpatient. 99,418 is prolonged inpatient. So in our case, it is outpatient. So it says evaluation management services time with or without direct patient contact beyond the required time of primary service. When the primary service level has been selected using the total time, each 15 minutes of the total time list separately in addition to the code of the evaluation management services. So the correct answer is 99,215 and 99,470. Question number 22. Primary care physician sees a 55-year-old patient with chronic obstructive pulmonary disease in the office for a routine follow-up visit. The physician carried out a moderate exam with moderate MDM. The physician determines that the patient needs pulmonary function testing to evaluate their COPD. The physician orders the PFT and a licensed practical nurse (LPN) performs the test under the supervision of the physician. The nurse performs the PFT and notes the results in the patient's chart. However, the patient had difficulty during the test and the nurse spent an additional 95 minutes beyond the typical time with the patient. Of the following, which codes best describe the encounter? So there are 4 codes available. Take your CPT code book and find the answer. So here you have to highlight, this is a primary care physician, sees a patient in a routine follow-up and level of decision making is moderate, and caretaker, that is nurse, also spent time, that is 95 minutes. When you see the patient's encounter, this is an office visit and routine follow-up. So it's an established patient. You have to go to the codes office and establish patient. Then you have to find the code for the moderate MDM. So go to the evaluation and management table of contents. Here, office or other outpatient services. Here you have to go to the established patient. So it will lead you to 99,211 to 215. 2013 is low level of medical decision making. 2014 is moderate level of medical decision making. So our case that is moderate level of medical decision making. So the primary code is 99,214. So we have found the primary code. Then we have to give the secondary code, that is for additional time encountered by the nursing. So nurse is a clinical care staff. So she spent 95 minutes. So again, go to the evaluation and management table of contents. Go to the prolonged services. Here the prolonged service given by the clinical staff. You have to go to this one. Prolonged clinical staff services with physician or other qualified healthcare professional supervision. So here in the physician supervision, the nurse done the procedure. So this code you have, that is 415 or 416 you have to use. So once you go to the code, the 99,415 is prolonged clinical staff service during an evaluation management service in the office or outpatient setting, direct patient contact with physician supervision, first hour. So first hour you have to use 415. But in our case, 95 minutes spent. 1 hour plus 35 minutes is spent. So first hour you have to code 99,415. Additional code, each additional 30 minutes you have to code the 99,416. So here additional 35 minutes. So that is one slot is there. So you have to add 415 plus 416. So in this question, the correct answer is B. That is primary code 99,214 plus prolonged code 99,415 and 99,416. Question number 23. A 16-year-old patient is admitted to the hospital due to severe pneumonia with complication. A pulmonologist provides an initial evaluation and management service. The visit includes a comprehensive history and a detailed physical examination. The physician reviews a chest X-ray which indicates pulmonary consolidation without volume loss, suggesting lobar pneumonia. Blood tests reveal an elevated C-reactive protein. The encounter involved high medical decision making. The physician spent an additional 40 minutes beyond the typical time for EM service, evaluating the patient, reviewing medical records, and prescribing antibiotics. What EM code should be reported for the physician services? So there are four answers available. Take your CPT code book and find the answer. Okay, in this case, you had to highlight patient is admitted. So it's an inpatient. The level of medical decision making is high level, and physician spends 40 minutes beyond the typical EMM service. So this part easy. They are additionally mentioned the prolonged time period, that is 40 minutes. Okay, so first we had to find the primary code. So primary code, this patient is admitted. So inpatient, high level of medical decision making. So there are two ways you can use. One is you can go to the EM evaluation management table of contents and find the primary code, or else you can see the answer. All four answers having 99,223 or 22. So you can use the elimination method to find the answer. So you can directly go to the codes 2,223 and 22 and check which is suitable. When you look at the answer, 99,222, initial hospital inpatient or observation care, moderate level of medical decision making. But in our case, that is high level of medical decision making. So 99,223 is initial hospital inpatient or observation care, high level of medical decision making. And you can see the prolonged code here. For services of 90 minutes or longer, use prolonged code. But in our case, the prolonged code is separately mentioned, that is 40 minutes. So inpatient 40 minutes. Okay, in this case, you have to go to the prolonged services. Prolonged service with or without direct patient contact. So this is the area you have to look at. The physician evaluate and assess the patient. But here, prolonged clinical staff service. So this service you have to get. So go there. So here 19,470 says prolonged outpatient. But in our case, it is prolonged inpatient. So you have to go to this code 19,418 prolonged inpatient or observation evaluation management services, time with or without direct patient contact beyond the required time of primary service, when primary service level has been selected using the time. Each 50 minutes of the total time list separately in addition to the code. So each slot of 50 minutes you had to give one code. So here in our case that is 40 minutes. 40 minutes mean two 15-minute slots are there. So you have to multiply 99,418 into 2. Additional 10 minutes you can't do anything. If 50 minutes complete only, you have to code this code, additional code. So in this case, the primary code is 99,223. Prolonged code is 99,418 into 2 because 40 minutes there are two 50-minute slots are there. So remaining 10 minutes we can't do anything. If it is 45 minutes, you can multiply by 3. Otherwise, so the correct answer is C. Question number 24. A physician is conducting a review of medical reports today for a patient who was seen in their office the previous week for a follow-up appointment. Also, the previous visit was a low MDM visit. The physician spent 1 hour and 30 minutes reviewing the patient's record, making notes, and documenting the patient's treatment plan. Because the patient seems to have an underlying autoimmunity disorder associated with the patient's thyroid, the doctor will consult with an endocrinologist for diagnosis confirmation. Of the following, which code best describes the encounter? So there are 4 answers available. Take your CPT code book and find the answer. So the physician reviewing the medical records today, but patient who was seen their office previous week. So this is the evaluation and management, the day other than the evaluation and management. So here you have to directly go to the code rather than going for the primary code for this MDM, as I explained in the initial part of the video. Okay, here you have to go to the prolonged services, newly added code, that is prolonged service without direct patient contact on date other than the face-to-face evaluation and management service. So that include 19,358 to 59. So go to that code area. So here you can see 99,358 is prolonged evaluation and management service before, endo, after direct patient care, first hour. 99,359 is each additional 30 minutes. This separately in addition to code the prolonged service. Physician spent 1 hour and 30 minutes. So 1 hour and 30 minutes mean that is included here. That is 99,358. That is up to 1 hour and 40 minutes. Again, additional 60 minutes is coming under this. That is 99,359. So the correct answer is C. That is 99,358 and 99,359. So this is the end of prolonged services guideline and the example. So if you need any clarification, please leave us a comment. Please subscribe my channel and check my playlist for other parts. Thank you.